Hello, I'm Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. Today's topic is fibroids. Fibroids, or Leiomyoma uteri. They're very common non-cancerous tumors of the uterus that up to 70% of women have by the age of 50. So most women end up encountering them. In fact, the number one reason for a hysterectomy in the United States is fibroids or leiomyoma. Does that mean you'll always need a hysterectomy with fibroids? Absolutely not. But we'll just go over some general information and to tell you that they're more common. The most common time to start experiencing them if they're going to cause trouble is in the 40s. Once you go past menopause, they generally stop growing and can shrink and rarely cause problems after that, but not always. And like I said, most of them are benign, non-cancerous, but with rare exception, there are some that are. However, that's really a rare circumstance. But the main thing to know is that fibroids are common, and depending on where they're located, they can cause bleeding, cramping, discomfort, bloating, and increased size of your uterus, or they can do nothing depending on where they're at. If they're in the lining of the uterus, those are the ones that can often cause bleeding, even if they're small. If they're on the outside of the uterus, so that the ones in the lining are called submucous. The ones on the outer part are called subserosal, and they often cause no symptoms at all unless they're quite large. They're more common in African Americans, and we don't know why, but they just are. And they can often have them earlier. The way they're detected is with an ultrasound. They can be seen on a CT scan or an MRI as well, but ultrasound is the most common way to detect them. And having a pelvic exam, a bimanual exam, is how to know that perhaps the uterus is enlarged. So if you look at my other video on dealing with heavy periods, some of the interventions, there is the IUD, the ablation, and fibroids are part of the process why we need to do an ultrasound. And if they're present, then they may preclude the use of the IUD or the ablation to treat your heavy periods, okay? So what can be done with fibroids? Well, sometimes we just watch them. Sometimes we recommend removing them and leaving the uterus intact, especially if you get them at a younger age and you plan to have kids. Depending on their location, they might increase your risk of miscarriage or prevent you from getting pregnant. And there is a surgery called a myomectomy, where we remove the fibroids and leave the uterus. With some recent changes, it is a pretty major surgery, and so if you're done having kids, we don't often recommend that you have a myomectomy removal of the fibroids. Instead, we recommend having a hysterectomy, generally leaving the ovaries in place. There are other procedures like a uterine artery ablation, or ablating the blood vessels that go to a fibroid. That's using a catheter up in the leg, and then the interventional radiologist threads the catheter to the blood vessel, main blood vessel. It goes to the fibroid, and then they put these little micro beads that rob it of its blood supply, and it shrinks down. Sometimes that's effective. A lot of patients have lots of discomfort with that, and it can also, the fibroids can come back, or other fibroids can grow, but there are certain circumstances where it's an appropriate intervention and works well. There's also some other expensive higher tech devices that use MRI guidance and high frequency ultrasounds to try to destroy them, kind of like lithotripsy, and that has been on and off available, but not widely used, at least not in my practice, and not that I've heard of, but it is a less invasive potential procedure in the armamentarium to deal with fibroids. So hopefully you found this information informative and useful. We'll provide some links for you to get more information. Bottom line is, it's common and sometimes can cause you troubles, but not always. And that's one of the reasons to have regular visits with your physician to keep track of your progress, your pelvic exam, your pap smears, and routine gynecological care.